Hello everyone, we all know step 3 is important exam. It is important to find a one source which covers everything and things you need to know to pass that exam rather than covering 10 different sources and not doing good on the exam. Let's cover CCS. Important thing, most of the CCS cases are presented in ER. Do not automatically assume that this is an emergency case just because the patient is in ER. Look at the patient's symptoms, see if this patient needs emergency measures, then go from there. There are two types of time. Real time, this is the time given to you to solve the case, you cannot move this time. And the case time, this is the time given to you to diagnose and treat the condition, you can only move this time forward. For example, after ordering labs, you move the time forward to get the lab results. Or after ordering imaging, CT, MRI, X-rays, you move the clock forward to get the imaging results. Or even if you send the patient home, you move the clock forward to bring the patient to the clinic or to the hospital for next appointment. Diagnosis. Actually, there are three types of scenarios presented in CCS to test your ability that you know how to manage the case. First type of scenarios, these are emergency case scenario. CCS expects you to do the emergency measures before doing physical examination. For example, patient with MI, CCS wants you to give the patient aspirin, nitroglycerin, oxygen, morphine, do the EKG, then do the physical exam. Another example is asthma. Scenario number 2. In this kind of scenario, CCS expects you to go one step further than the history of the patient. They want you to do the physical exam, then get the clue to the diagnosis. For example, in this case, we can see this patient, a 5-year-old patient, has a pain in the stomach, and the pain did not go away with the Tylenol. But there's nothing in the history which pinpoints the diagnosis. And when we do the physical exam, we see the patient has a pain in the right lower quadrant. He also has a pain at McBurney's point. So this is the diagnosis of appendicitis. Another example for this scenario, an old patient with lower abdominal pain, and when you do the physical exam, you see the pulsating abdominal mass. This is the diagnosis of abdominal aorta aneurysm. Scenario number 3. In this kind of scenario, CCS wants you to go one step further than the physical exam to get the diagnosis. They want you to do the labs, then get the diagnosis. From this case, we can see this 10-year-old patient has a bleeding tooth. Even the physical exam, you see the blood oozing from the extracted tooth, but this doesn't give you any definitive diagnosis. And when you do the lab work, you see this patient has a high PTT and low factor rate. This is the diagnosis of factor rate deficiency. So make sure you pay attention to all these scenarios and go according to the scenario.